this is a specific question, and it's a good question. Two phenomena that you're supposed to know: Raynaud and Buerger's disease. The Buerger's disease is the thromboangiitis obliteratum. They can ask you standalone question, or they can give you a case. They look the same, but they have different pathophysiology. So I would just explain them quickly, so that in case you see them next time, you'll be able to recognize them. So Raynaud is different from Buerger's disease. Raynaud is a vasospasm. That means this vessel cramps down because something happened to that. So it's not an inflammatory process, so not inflammation. It's not, it's just a vasospasm. The vessels clamp down. So blood flow to the extremities decreases. And what causes the problem is like extreme temperature. So these are the risk factors. You have like extreme temperature physically, cold and high temperature. So you want to be like in a normal temperature range. So extreme temperature, our patient is very stressed, emotional, will causes the vessels to vasospasm and clamp down. So less blood, basically cut off blood flow to the extremities. And therefore what happens? The fingers or toes become like what? Blue or white, you know, blue and white. But there is no inflammation. So that is the problem. And so basically you can see from the pictures, one is black, the other one is blue and white. So this is classic Raynaud. This is a Raynaud problem. This is not Raynaud. This is completely black. You know, there is necrosis and everything. But this one, the fingers are like white, and the rest of this is turning bluish color. It's because of blood flow is decreasing. And so that is and it's not an inflammatory process. It's a vasospasm. The vessel go into that area in spasm as soon as the patient is exposed to a stressful situation. And so that is the pathophysiology, right? What do you think? How would you treat this patient? Most of the time is education. Okay, I got to educate you to avoid that vasospasm. So you provide teaching to the client and what they do. And it's usually in a SATA form, right? You tell them to wear gloves if you're going outside when it's cold. Okay, I want you to wear gloves when cold outside or when it's too warm, right? Basically, you should avoid stress. I don't know who can avoid stress, but try to avoid stress as much as possible. Dress warm also when it's cold outside to help with that. Mostly extreme cold causes that. And then you want to avoid your body natural vasoconstriction. So you should avoid like vasoconstriction of your vessel, because then it's going to worsen it. And this is where you have to provide specific teaching, right? You cannot have caffeine. Caffeine will do that. It will cause vasospasm. You can't have cocaine, okay? You can't have all the amphetamines. They are vasoconstriction. So cold syrups, of course, when you get cold, be careful. When you go and drink them, it can trigger the problem because they all has vasospasm constrictors. That is the way they function. So this patient, you tell them to avoid all these medications. Of course, tobacco is also good. So avoid tobacco as much as possible. If they give you a question and they say, how do you treat this? What can you do? You can open the vessel. So open the vessel as much as possible. If it happens, and what can you do that? What medication you can use? Topical, calcium channel blocker. So you can choose any one you want. So far as it's topical, I'm good with that. So that's an answer choice you can pick. So I'll come to it. Somebody's asking a question, the black. Yeah, we're doing the both. So we'll do the rest then after that. Okay. So you can give them topical. Yeah, black is not Raynaud. Yeah. I'll get to it later. We'll talk about it. So I can give you something to open your vessel when you get this vasospasm. So let them have topical calcium channel blocker. You can pick anything you want. Nifedipine, cream, or deotiazem and cream. It's fine. All of them can be used. They can put it in your and rub it, and it can open the vessels, and they will do fine. It will help with that. Or they can just put their hand in warm water when it happens, just something lukewarm to open the vessel. But the topical agent this is what usually they can use. That's the most common medication they can give: calcium channel blocker topical for Raynaud phenomenon. And therefore, it said, who do you see? They give you a Raynaud patient, right? And it said blue or white toes or fingers. When exposed to extreme cold or stress, well, don't see that patient. Because this is normal finding. That's the definition of Raynaud phenomenon. They are not a big problem. That's what you expect. You just give them calcium channel blocker and they will be fine. Okay, so that's that portion. It's not the same as frostbite. Frostbite is you putting your hand really, really into, your hands are so cold. This one is different. Frostbite is cold, freezing of your vessel, your blood basically is different. Okay, so that is different. In Raynaud, it's just the vasospasm. There's no vasculitis or there's no infection anywhere. There's no inflammation anywhere. And it's the top slide, as you can see, it's just turning blue and white. Okay, and that is the problem. The Buerger's disease is different. It's a different animal altogether. And so that's why they try to confuse you with, but they have the same phenomenon, you know. So for Buerger's, that's how it's spelled, Buerger's disease. This is vasculitis, okay? This is the same thing as what happened in Kawasaki. Kawasaki, the difference between Buerger's disease and Kawasaki is big vessels, the coronary arteries. That's why they develop coronary aneurysm. Buerger's disease is a tiny, tiny, tiny vessels that supply your fingers and your body. And so most of the tiny fingers are near your fingers and your toe. That's why the toe turn blue. So it's a vasculitis, inflammation of those tiny vessels. So these small vessels, and mostly they are in your toes and in your fingers. And what is the problem? Number one is tobacco, okay? And pay attention. If they're going to give you a case, okay, the exams is going to be a classic. They're not going to give you something weird. So when they're going to describe a case, they're going to give you something specific. Okay, something specific for that disease process. So what it will give you is classic, like this guy. It's going to be a male, young male, maybe 25 to like 40 years old. That smoke like a chimney, you know, tobacco is a smoker. Smoke a lot of time, I mean, in a long time. And they will come in with just a blue toe, just really, really blue and black, and they will have ulceration. Raynaud will never show any ulceration. They're not going to have any ulceration. The hand will look red, like you can see, red and white. This one black. The toe is dead, and the finger is dead. Okay, they're putting this in water will not going to change anything. And so some of the time, the surgery treatment is amputation. You're going to amputate those fingers. They're dead, or they themselves will auto amputate if it's a dry gangrene. So these are like gangrene. They themselves will die and cut off. Some people need surgery to cut it off. So that is the difference. There is inflammation. Number one cause is tobacco, and it's a vasculitis. And so for your treatment, it's easy. Please stop smoking, okay? Tobacco, stop. Okay, stop smoking. That's all. And most of the time, it helps. You can give them calcium channel blocker in a SATA question. It's also reasonable, okay? It's also reasonable to use it. But number one for Buerger's disease is stop smoking. So when they give you a case and you see that the person smoked tobacco, it's a young male, yeah, it's not Raynaud. It's going to be like Buerger's, and his fingers look like that. Okay, so that is the key fact between the two of them. Okay. Okay, so that is the difference. So if they ask you for this young patient, what complication can he get from it? You see, you're getting vasculitis and thrombosis. It's all thrombosis of these vessels that is now dying. There's arterial thrombosis. That's why the vessels are dying from the vasculitis, where they can get a heart attack, right? They can get stroke. Okay, so that's why you got to educate them to stop smoking. Otherwise, they start having MI and stroke, and that's the biggest problem about this issue. So, any questions between these two disease processes? Don't get them confused. Okay. So the same thing, Buerger's disease. If they give you a case, they say a Buerger disease patient with the blue-black toe. Basically the toes are dead. It's not going to cause anything. It's dead. There's nothing you can do about it. That's why it's called Buerger's disease. Okay, so that's what you need to know about that. Any question? Finish. And then there's this one, heat exhaustion, and then stroke. So it can be very confusing, I understand. Briefly, okay. There's always classic. Somebody go outside. So you go outside, right? Time is going. So outdoor, temperature is too high. You don't drink. And all of a sudden, you're dizzy. This is the way to present it. Headache, you're having nausea and vomit, weakness, right? Your skin is going to be moist and warm. That's different. And you get muscle cramps. This is what we call heat exhaustion. That is different. Remember, look at the signs and symptoms. It's almost like dehydration. But they go outside, They have all these signs: dizziness, headache, nausea, vomiting, weakness, skin is moist, and the muscle cramps. Basically, they're on fire, they get fatigue. Okay, all this thing is heat exhaustion. There is no neurological problem. That is the key, neurological. Okay, what is your treatment for this patient? It's just cool them as much as possible. Cooling is your number one. You want to cool them as much as possible. And if they have no neurological problem, they can take PO like Pedialyte. Okay, you can give them Pedialyte to help with that, but they will need IV fluid. At the same time, they can take something by mouth. So that is the key. You can give them Gatorade to replace the electrolyte and everything. Sometimes these people have fever. Okay, the temperature can go up like 102, 103. So this is heat exhaustion. When does it become stroke? Just one word: neurological symptoms. They get to the point that they are having neurological symptoms, and that is where you have to worry about mental status change. Yes. And they have end organ damage. I use that word so that you can put anything you want. They can have acute kidney injury. They can have rhabdo. Okay. Rhabdomyolysis. This patient has crossover. The temperature is almost like 106. Okay, or 105 there. They've crossed over now, and their skin is now going to be dry. They can't even sweat anymore. Okay, they can't even sweat. So these people, they have dry skin and they cannot sweat. That's stroke, and that's deadly. So this patient, I thought Pedialyte can be used for diarrhea. Yes, this patient is dehydrated, so you can give them Pedialyte to replace the electrolyte. It has a lot of electrolyte, so you can give it to them. That's why we give it to diarrhea patient. This patient, what do you think? They're about to die. So if I say pad all four rails of the bed, you should not say, what are you doing? When I said lower the bed, when I said cardiac monitoring, all this is indicated. Why? Because they're going to die. They're going to go into seizures. So when you see answer choice like that, don't worry, don't like, oh, why are they giving me this problem? That is what this patient will go into seizures. It's bad. So that's their complication. They go into cardiac arrhythmia and all those things. So you want to like get them, they go into respiratory failure, and they will have seizures, some cardiac issue. So you need to cool these people fast. They can have liver damage. So cool them fast. So every orifice is getting some ice fluid everywhere. We got to like cool you so fast that otherwise you're going to die. But no fast, but you got to bring their temperature down. They're having seizures. So you got to be like, think about it. That is the difference. So if they give you a question and you don't see a change in mental status, neurological problem, all these things I've mentioned, I don't want to give you signs and symptoms, a bunch of them. I'm using this word. This is the only difference. Mental status change, then the rest is their exhaustion, basically. So that is that topic. That's all. That is the two difference between them. One involved in neurological states, the other one doesn't involve in neurological states. But you have to work fast in order to get them, to prevent them getting into exhaustion.